Rheumatoid arthritis is a chronic destructive disease of joints. It classically involves the small joints of the hands and feet first. It affects women more commonly than men. Classically starts in the 5th and 6th decades of life, affects just under 1% of the population. The most common complaint is pain, and pain in the joints. Inflammatory pain, and by that I mean the pain associated with rheumatoid as opposed to osteoarthritis, is characteristically associated with marked stiffness of the joints. And the joints are stiffest when they've been rested, so particularly first thing in the morning and with any periods of rest. The next thing that they complain of is swelling of the joints and loss of function of the joints. So it's often in the hands are painful. The typical joints, these knuckle joints, become inflamed and swollen. They become stiff in the mornings. Patients get up and have to put their hands in hot or cold water to get them moving, and they find they're becoming weak and not being able to function so well. The most commonly used disease-modifying drug is methotrexate. That's been used for 30 odd years in rheumatoid arthritis and is a very effective drug. Others, such as gold injections, are used much less frequently now, and there are 4 or 5 of these disease-modifying drugs. Now, these drugs, by their definition, slow down the process of damage and can be very effective. But we have a new class of drugs called biologic agents, and there's a move certainly in this country and elsewhere to use these drugs earlier. The problem with drugs, of course, is they have side effects. The problem with the biologics is they're expensive, and we have to use them for the patients who need them. But we certainly like to, in any person who might have the potential for damaging arthritis, to use these drugs early, because these are even more effective than the disease-modifying drugs and can, in almost every case, stop the destructive process that underlines rheumatoid arthritis.
Stratified medicine is a groundbreaking approach to treatment that could transform the way doctors treat diseases. At the moment, if you become unwell, you're grouped together with everyone who has your condition. Doctors prescribe your group the same drugs, taking only simple differences such as age and weight into account. If one treatment doesn't work, they try the next. This can cause side effects, as well as leaving patients unwell for a long time. But with stratified medicine, doctors will use a range of new tests to understand patients' likely response to treatment before prescribing them anything. So, rather than treating everyone who has a disease as exactly the same, they will be divided into a number of groups. This group are likely to respond best to drug A, whereas this group are likely to respond best to drug B. People in this group may have adverse reactions and are unlikely to respond to any of the current treatments. What kind of diagnostic tests are people happy to take before they receive treatment?